Markets are shuttering. Bay Staters are grappling with rapid-fire federal deportation efforts, and government cuts are working their way through the courts. One of the many systems in triage mode right now is Veterans Services, anticipating massive staff layoffs while tasked with managing the care and benefits for roughly 16 million vets here in the United States, 250,000 of which are right here in Massachusetts. I'm Jennifer Smith, and this is the Codcast, CommonWealth Beacon's podcast about policy and civic life here in Massachusetts. Today, I'm joined by Veteran Affairs Secretary Jon Santiago. Secretary, I looked back, and you were here with me on this podcast, not virtually, but actually in our podcast studio, almost exactly 1 year ago. A lot has changed since then, so thanks for being back on.
Well, it's great to be with you. Happy to chat about what's happening in the world of veteran affairs, not just locally, but nationally. Good things and some not so good things, but happy to be here.
So speaking of anniversaries, it actually might make sense to start with the End Veteran Homelessness campaign, which launched in Massachusetts in March 2024. So again, almost exactly a year ago from when we were talking. We're about a year into the $20 million effort that's aimed at making the state a place where the feds are calling it, quote unquote, functional zero. So that's saying that homelessness would be rare, brief, and non-recurring. We're about a year in. How is it going?
That's absolutely right. We're excited about the progress we've done on the End Veteran Homelessness campaign. Let's face it, housing and homelessness continue to be a priority for the governor. In fact, it's because of her leadership and that of Lieutenant Governor Driscoll that they've challenged every secretariat to get active on this housing issue, right? And so from our perspective, we sought to support our veterans, particularly those who were housing insecure. And so, as you said, we're about a year into the program, about 7-8 months since the money's been let go, and some great results. There were 5 pillars. The first pillar was called the Hope Campaign. It was focused on doing outreach and supporting veterans and getting them housed. And to this point, again, about 200 veterans have been housed, half of which have been housed with permanent supportive services, the other half transitional. So we're excited about that. The other important piece to this campaign is that of building units. How do we create more units in the pipeline? And so if we're looking at this year, from beginning to end, soup to nuts, we're looking at about 300 units somewhere along that pipeline that will get started. Now, whether that's a ribbon cutting, a groundbreaking, some paperwork, some delivering of funds, we're excited about that. We'll be having some groundbreakings throughout this year. But overall, it's really about connecting some of the federal resources to the state resources and connecting people. It's been my experience in government, not just when I was a legislator, but that now that I'm in this role, is that when we're connecting people working together on an objective, we can get so much farther. And we've proven that in the case of End Veteran Homelessness. We're having results, and we're excited about it.
So the problem is you set off my little housing bell that everybody knows to avoid, generally speaking, because my question is essentially, the whole state is kind of engaged in this competition for what land there is. There's a really sort of inhospitable building environment right now. There are questions about to what extent federal funds can be relied on. So how is Veterans Affairs dealing with the kind of broader housing crunch? Is this all kind of piecing together from the administration's perspective, or is it kind of its own silo?
Well, what I will tell you is that external stakeholders have been quite excited about this opportunity. I mean, we receive emails, communications from all kinds of providers, whether they be public, cities and towns, private developers, expressing their interests in supporting veterans and developing housing for veterans. So we are flooded with calls and suggestions, some of which come with money, some of them looking for partnership. I mean, we had a developer recently who's building 100 plus units and looking to set aside a portion of those units for veterans. And so our goal is really connect them to services, whether it's a VASH voucher, that's a federal voucher from the feds to house a veteran, or funds. And some of the funds that were put forward in our $20 million, in fact, more than half of that was to support some of these endeavors. So we're excited about that. And again, Governor Healy has prioritized this issue. The Affordable Homes Act, led by Secretary Augustus. I mean, this is $5 billion bond bill really focused on this. And so on all accounts, throughout every secretariat, we're focused on this issue, and we're excited about where we're at now, but we know there's still so much work to do. And in the case of end veteran homelessness, we've made some significant progress over this past year.
And the project, of course, also involves cooperation between local, state, federal services, which brings us to the ever present question now here in 2025, which is how is the new presidential administration impacting this area of society? So I think from a very high level, what has your take been so far on the Trump administration's approach and posture toward veterans affairs?
Well, what I can tell you, speaking as not just a veteran, but also as a physician who has cared for veterans and active service members, there's a lot of concern out there. There's been talk of funding, but primarily there's been talk of cuts to workforce. As you know, the VA is a major player. There are hospitals all across this country, clinics, services. I mean, we're talking about 480,000 employees, and there's been talk of, directly from the secretary himself, I might add, of cutting 80,000 people. Now that's, 15, 20% of the workforce. Now, again, putting on my physician hat, clinicians and providers need a whole host of support services to get the job done, right? So for every one provider you have, you need 4 or 5 support services, right? So when you begin to take away those folks, those key positions, that can definitely impact the care that veterans are getting. And you've seen that already happen. I mean, first couple of weeks of administration, there's a reduction in force of 1,000 VA workers, followed by 1,400. Now, many of those have come back thanks to a temporary restraining order, but that in and of itself, because of the chainsaw approach to this, wasn't very targeted. And you have people like, for example, one gentleman I met in Western Mass, a veteran deployed 4 times, twice to Afghanistan, twice to Iraq, I believe, who came back to support veterans at a vet center who were receiving mental health services. He was let go of his job. He was tasked with opening the office, supporting the providers, making sure veterans were connected. And when he's not there, who's going to do that stuff? And so it's important that, listen, we all believe that waste, fraud, and abuse should be addressed, right? But the mechanism by which they've been taking this chainsaw approach hasn't served anyone well. And the concern is, and again, that's talking about 1,000 or 1,400 people, 80,000, a lot of red flags here.
As you noted, VA Secretary Doug Collins announced these plans to make these pretty substantial cuts in the workforce here. He said also that individuals who work directly in healthcare for veterans or processing veterans' benefits will not be impacted and that a more efficient department is going to benefit vets. How do those promises strike you?
Well, as I said, every provider needs a certain number of supportive services to get the job done. A clinician cannot be also an administrative assistant as well, can't schedule appointments, can't open up an office, right? So you're going to need these folks. I think that the challenge is that what the administration often doesn't talk about is that there's been a significant increase in the number of veterans getting care and receiving benefits, right? President Biden passed the PACT Act, right? The largest increase in veteran services or veterans benefits and resources in a generation. That brought 1 million people into this network of veterans receiving services, right? $7 billion. I mean, I think 22,000 people alone in Massachusetts, right? So when you have an increasing community that you have to care for, provide services for, but you're taking away the staff, it's concerning. I mean, I'll give you an example. The VA itself, the IG of the VA, I think this is in 2024, put forth a study saying there was a 3,000 person staffing shortage, and that 137 of 139 facilities had some of these shortages in their building, right? So this is a real issue, and taking away or reducing the staff is a concerning thing to contemplate at a time when more veterans are getting services and they need services. And again, if we are going to be a country that honors the service of those who've spent time abroad, who've worn the uniform, who've signed their name to commit their life to serving their nation, we better be supportive of them. And I'm proud to say that in Massachusetts, I mean, we're continuing to do that.
So thinking about what can be done on the state level then to sort of shore this up, because it seems like every department these days is trying to figure out how to essentially be a bulwark in some ways against the cuts, either financial or staffing, coming from the Trump administration. So what's the approach been?
We here in Massachusetts continue to be a standard bearer when it comes to veteran services and benefits. We are investing more in veteran services than we ever have before. And we are engaging with veterans more than we've ever before. It's because of Governor Healy and Lieutenant Governor Driscoll, we have the first ever secretariat in veteran services. And as you can recall from our prior conversations, there were a number of issues that had to be addressed. And I think it was our first time speaking a couple of years ago when I described the project as somewhat of a startup and turnaround. And the plan was to give me 2 years to help turn around, particularly at our veteran homes. And just let me paint a picture for you, Jennifer. 3, 4 years ago, in the midst of COVID, you had two facilities that were not licensed by the Department of Public Health, run by operators not licensed to run nursing homes. You had paper medical charts, paper scheduling. And over the course of the past 2 years, we've done all that. We've transformed that. We have electronic medical records, buildings are licensed. We've addressed infrastructure issues. We've built a brand new home, state-of-the-art home at Chelsea. We've secured $500 million to build a new home in Holyoke. That's ahead of schedule. So we've done a lot of work to support our homes. Meanwhile, also targeting investments into things like homelessness, as you said, the largest investment ever to tackle this issue, and pass things like the HERO Act, the most comprehensive piece of veterans legislation ever passed in our state's history. So we're excited about what's going on in the veteran space in Massachusetts, realizing that there's so much more to do. And given what we're facing in Washington, we might need to double down on those efforts.
Right. So I'm glad you mentioned the HERO Act. So a quick primer for folks who aren't familiar. We're going to use Senator John Velas's description here saying, the act increases and simplifies benefits and opportunities for veterans, modernizes and expands services and resources, and promotes inclusivity for Massachusetts veterans. We'd be here for about 7 hours if we were to run through all of the inclusions in this piece of legislation that include things like supports for military spouses and families, benefit reporting requirements, expanding eligibility for the state vet benefits program, just kind of on a baseline level. So what is one or two significant aspects of the legislation, in your view, Secretary, that might be kind of slipping under the radar because there's so much in there? Are there significant ones for you?
Well, I think a big one was the definition of a veteran and how we classify veterans in this state, right? So there's a lot of talk of what it means to be a veteran. And that's important because that could determine eligibility to certain benefits, right? And the feds, which thanks to their leadership, they've actually moved forward on this in a more inclusive way, right? We here in Massachusetts, we had a very strict definition. And so we tried to align ourselves more alongside what the federal definition is for benefits. And that helps in a number of ways. Number one, it allows more veterans to receive services, but it also says, listen, folks, if you served your country, we should support you, and whether it's through a financial benefit or through an actual service. I think another thing that we do here is that we try to support veterans who are traditionally underserved, right? Veterans who may be minority, Black or Latino, veterans who have been disabled, women veterans, the fastest growing community of veterans. And so this bill was precisely about how do we expand services, but also how to be inclusive at the same time, really transforming veteran services in the Commonwealth, but bringing us to the 21st century.
Is there any concern that there might still be kind of future conflicts almost in philosophy between Massachusetts' approach to veteran services and the Trump administration? We've seen, drips and drabs here and there of them, removing documentation about people of color who had served in military roles. There's been a lot of discussion about how they're approaching kind of the broad question of diversity, inclusion, equity, that sort of thing. So I'm just curious, are you keeping an eye on any efforts to pivot the federal resources away from some of the areas that Massachusetts has really kind of been committed to in recent years?
Well, fortunately, the vast majority of our budget here in Massachusetts is state funded, right? There are significant amounts of federal funding with respect to infrastructure at Holyoke and Chelsea. It's a 65% grant funded by the feds here, but with regard to our programming, the vast majority of it is state funded. And we feel, make no mistake, very committed to the goals of equity and diversity when we're talking to our veterans and their families. I mean, it's important to note that it's not just the veteran himself or herself, it's their family that bears the sacrifice and commitment as well. And so that's one of the things that we've been doing over the past 2 years. I think also, since I got here, one goal is to really integrate ourselves with the VA. Let's not have a certain level of redundancy. Let's make sure we're working together. At the end of the day, if I can get someone on VA benefits, whether that's a compensation benefit for your disability or whether that's healthcare at a healthcare system, and now I'll also say I'm a VA patient as well. I believe in the VA, right? I can really change someone's life. And so, how do we cut the bureaucracy, the red tape? How do we work more closely together? How do we align our goals? That's been my mission since day one here as secretary, and we've done a lot of that work. And my hope is that it will continue, but there are obviously some challenges right now coming from DC. And I think the challenges is really the uncertainty with respect to their commitment to staffing at the VA, right? and their approach to things like, diversity and equity. So, more to see, and we will take it one day at a time here. What I can tell you is that we are committed to supporting our veterans, and if there are folks out there listening who are a veteran or who related to a veteran, please know that we at the state, we value your service, your commitment, and reach out to us. We're here to support you.
And you mentioned, of course, the new facilities. We have seen recently finishing and then also development in progress on the two state veterans' homes facilities, which some people, unfortunately, might be familiar with because of the tragic deaths of 76 veterans during the height of the COVID pandemic under the prior gubernatorial administration. So we'll talk about infrastructure, but I think first it might be helpful a year after we last talked. How would you describe your approach to reform at the state veterans homes since taking the helm? We're 2 years in now.
Yeah, so as I mentioned earlier, put ourselves back during COVID, pre-COVID. I mean, these buildings were stuck in the 20th century, 50, 60 years ago. I mean, they were operated by people not licensed to run nursing homes. The infrastructure was dilapidated at both homes. They were not licensed to be nursing homes. And it's kind of wild that this was allowed to persist here, right? So COVID happens, and tragically, 76 people pass away at Holyoke and about 30 or so at Chelsea. But what comes of this is a desire to really address this issue head on, to really fix the infrastructure issues, right? Expand upon our commitment to veterans, but also bring this to the 21st century. I mean, there was a conversation about electronic medical records, right? They were still on paper. No, so whether it's electronic medical records, whether it's infrastructure, whether it's supporting the staff with investments in workforce development, that's what we've done. And I can tell you that the quality of care has improved. Chelsea is CMS certified by Medicare and Medicaid, right? Working on that in Holyoke, and that should be all set hopefully the next couple of weeks here. But if you were to look at the indicators by which we measure nursing homes across the state and across the country, at a place like Holyoke, where this tragedy occurred, Holyoke is outperforming, in many cases, on a whole host of indicators, the average nursing home in Massachusetts and the average nursing home across this country. And that's really a statement as a result of the leadership there by the executive director, Michael Lazo, and his wonderful team there. And so things have turned around. And we're not suggesting mission is accomplished by any means, but we're excited about the improvements and more to come.
So I am curious too about what kind of changes have been put in place for chain of command and communication, because that was a major issue under the prior leadership here. So essentially, how exactly are you as secretary kept abreast of issues if they arrive, given that the state serves nearly 250,000 vets and there's always demand for the hundreds of beds in these veterans' homes?
So that happened even before I stepped in as secretary. In fact, I was still legislator when I voted on this bill, Chapter 144, that completely reorganized the governance. And so whereas the executive director or superintendent, as they were called, would report to a board, right, they report to me now. And so we're in constant communication. We work together. A part of where we're at now in the beginning of year 3 is what I would call organizational maturation, not just for the homes, but also for the office as well. As I mentioned maybe 2 years ago, it was kind of a startup turnaround. We've done a lot of that. It's been transformative. The output and the outcomes are really reflecting that. And so now as we mature as an organization, what does that mean? As we mature when it comes to our collection of data, programming, the quality of care that we're given, and then documenting it. The fact that I can tell you that we have a dashboard where Holyoke is outperforming most nursing homes in the state and in the country on a variety of different indicators. We're excited about that. Again, more to do in Holyoke. We're looking to open up the new home November 2026. And, knock on wood, all things are going quite well and ahead of schedule. And that will significantly expand the number of veterans who are receiving long-term care there. And at Chelsea, the building's also been expanded to house up to 154 veterans.
And I think underlying a lot of these conversations is the question of trust, the veterans community trusting in the state to support it and kind of navigate through these uncertain federal waters. What are you hearing from veterans who are using your services, people that you might know from your own service in Massachusetts? What's the sentiment about what they're asking for from the state in this moment?
Well, I can tell you that there was a gap in trust when I took over, right? With what happened in Holyoke and Chelsea, that shouldn't be a surprise to anyone. But I am a strong believer in that leadership begins with listening. And so one of the first acts we did was to go all throughout the Commonwealth to engage with stakeholders, veterans, families, Western Mass, Central Mass, nonprofits, you name it, right? And to hear about their concerns, not just with respect to COVID and what happened in Holyoke and Chelsea, but writ large. And we took those lessons, and many of those we implemented, whether it's in the HERO Act, our approach to ending veteran homelessness, but we listened to them, we engaged them, and we delivered, right? We talked about the transformative investments and change at both homes. We talked about the HERO Act. We talked about the Ending Veteran Homelessness campaign. And it's been my lesson in this role that if you have a vision and you have the resources and a commitment to serve folks, you'll be able to address that gap pretty quickly, right? And when you have leaders who care about this, I mean, Governor Healy was born in a naval hospital. Lieutenant Governor Driscoll, his father's a veteran. They care about this personally and passionately. And it's because of their leadership that we have the resources to do what we need to do to really instill that trust that was so desperately needed particularly during the early days of COVID.
And we've heard floating that there might be a request or demand or consideration of a third possible facility. Why?
Well, there's always a hope for more facilities. The fact is that our veteran community is aging. Long-term care needs in the Commonwealth, irrespective of your veteran status, are growing. Chelsea and Holyoke they've grown. But during the Chapter 144 piece of legislation that created my office and this new transformation of the homes, there was also part of it that said we should be looking at the geographic equity, right? If you live in the South Coast, for example, how are you supposed to take care or go see your father or mother who's at Chelsea or Holyoke? And so in that bill from 4 or 5 years ago, there was a bond element that said $200 million to look into geographic equity. Now it's very preliminary right now, right? You have to get federal, state home construction grant to look at this, which pays 65%, right? And so we're in talks with a variety of stakeholders. I would say it's very preliminary. We just were awarded these two massive federal grants in the past 5 years, at Chelsea and Holyoke. But it's something that people care about. But I will also mention that there are other models to look at, whether it's aging in place, right? The VA has programs for that. We could be doing so much more than that. And so we're looking into that right now, supporting veterans age in place with their respective loved ones and other models as well. So we're excited about the conversations. I would say they're preliminary, but we're looking at all options.
And I think the subject that we might want to end on here is actually pivoting over to your other area of expertise, life. A lot of people know, of course, that during the height of COVID, you were balancing, I think, I don't know, 3, 4, 5 different hats. I don't know how many hats you wear on a regular basis, but as someone who has been very embedded in the medical community, especially in Boston, what is your feeling about the administration cuts on the National Institutes of Health sides, research grant side, higher education, a lot of which involve medical institutions? It's a big can of worms. How are you kind of keeping an eye on it, even though it's not literally your purview?
It is upsetting, to say the least. That sector isn't just the doctors and nurses that care for patients, right? I mean, it's such an integrated part of our economy, right? I mean, my wife is an NIH-funded scientist, right? And so when these types of things happen, right, and when people lose their jobs and access to treatment is cut, people will eventually be hurt by it, right? Will get sick. I mean, I think about the VA. The VA is a major research community as well. And these pauses and concerns about funding, it could impact 200 VA researchers that are working on 300 trials impacting 10,000 veterans. And the VA, whether it's the nicotine patch, the cardiac pacemaker, the liver transplant, that's just the VA, right? But when we talk about Massachusetts, particularly Boston, and the resources and just the history we have here, it is concerning. And so, we're a couple months into this administration. I feel like it's a new thing every single day. And, all I can do, and then what I tell myself as a physician, is you control what you can control, right? You're in a crazy emergency department and someone shows up with a significant injury. You stay cool, calm, collected, and you get to work, right? And that's my approach to government right now. The VA and the leadership, or the lack thereof, of President Trump and his leader, they're going to do what they're going to do, right? But we have faith in each other. We have faith in our partners, not not just within government, outside government, to really continue to fight for our veteran community, to make sure that we're honorably serving those who served us.
And last thing is, you've mentioned several times, and of course it's no mystery, this is an ongoing project. So what is the thing that I should be checking back with you on in a year from now? What's the kind of next big push?
I'm looking forward to our support for women veterans and those who are who've been traditionally underserved. I feel very strongly in the fact that, listen, if you served your country, irrespective of your gender or your race or your disability status, right, that we should honor that. And I think that's something that we in our office talk a lot about, and we want to make sure that our actions reflect that as well. And so we've invested more in our Women Veterans Program to really find folks who may not always have been so open to discussing their experiences. I think the other thing too is I'm passionate about mental health issues and addressing those. The one, I wouldn't say surprise, but really shocking part of this job is the number of calls I got with respect to veterans who had lost their life, who self-inflicted injuries. And as someone who's cared for many people and has witnessed a lot of death and dying, whether that's taking care of battlefield injuries or in a hospital like BMC, I was shocked by the number of times I was called from a family member who lost a loved one. And they just kept on coming and coming and coming. And as a result, we put together a working group to look into this issue. And no surprise, veterans more likely to be impacted by mental health disorders, more likely to experience substance use, more likely to own a weapon, right? Putting them all at risk for suicide. And so we put out a grant, a couple $1 million, funded several organizations, and so are working with them to better support veterans with mental health supports, but also some unique things that we're planning in the areas of safe storage of weapons and that sort of thing. So those are the types of things we're looking for, we're excited about, and we're not doing it alone. That's the best part. We're doing it with our folks out in the community, our veteran service, our VSOs, veteran service officers who represent cities and towns, nonprofits, people who are just passionate about this issue and want to honor the sacrifice of veterans.
Okay, I'll check in with you on that in the future. For now, thank you so much, Secretary Jon Santiago.
Gotcha. Thanks for having me on.
Thanks again to Secretary Jon Santiago for joining me once again on the podcast. Thank you so much for listening. I'm Jennifer Smith. Our producer is John Gee. Leave a rating and review wherever you're hearing this now if you want to help other people find us, and email codcast@commonwealthbeacon.org if you ever want to get in touch directly. And here at Commonwealth Beacon, by the way, it is April. It is Environmental and Climate Month, so we will be back next week with an episode focused on one of the splashiest aspects of climate resiliency here in the state. So keep an ear out. We'll be back.